Hello, I'm Drew Martell, the Director of Crisis Services at Foundation 2, located in Cedar Rapids. It's been nearly a month since the coronavirus pandemic became a daily reality for most of us in Linn County. I want to speak briefly about the impact that daily stress caused by the virus, social distancing, and a deep financial crisis have had on virtually all of our mental health. In times of stress, our mental health is easy to overlook, but remains critically important to our well-being, more so now than maybe any other time in our lives. The stress caused by a global pandemic, social distancing, and very painful economic realities that have hit many of us hard, combined with the constant uncertainty and the fact that good news can be awfully hard to come by, makes for an incredibly traumatic period for most of us. Whether it's concerns about the health and safety of our friends and family, the daily loss of life we hear about on the news, or the incredibly painful economic realities individuals and businesses are faced with as a result of the necessary social distancing guidelines we are now engaged in to mitigate the spread of COVID-19. Stress, uncertainty, and anxiety can be found in abundance. Physical distancing is something none of us have experienced to this extent that it is currently in place. Being isolated in our homes for hours, either alone or in close proximity to our family, can cause significant stress for both adults and youth. For those of us working from home, the day-to-day interactions and routines of engaging with our peers have been shifted to the virtual realm, if not discontinued altogether. For youth, the routine of school and time spent with friends has been disrupted, and important day-to-day supports for their mental health is no longer easily accessible. Being socially connected is an important part of the human condition, and it is something most lacking in this very unique crisis. For those of us at home with kids, we must also be keenly aware of their mental health during a frightening, confusing, and chaotic period. Unable to connect with their peers and thrown out of the predictable routine and structure of school, many youth are struggling with their own anxieties and depression. I want you to know that we are all in this together, and there are several supports available throughout Linn County to help you and your family through this very difficult period. Foundation 2 continues to operate both its 24/7 crisis line and our mobile crisis teams, who we've modified to have available for telehealth sessions. These services are free, and they are always available 24/7. Across the community, we are fortunate to have many dedicated and caring professionals and agencies, such as Abbey Center Community Mental Health, who operates a warm line, both of our amazing hospital systems, St. Luke's and Mercy, and a wide array of mental health professionals, all of whom have adapted their services to meet the unique needs of our time. I want to briefly cover some things you can do to be proactive with your mental health, and then give specifics on resources available and when and how you might know you need to reach out for professional support. Try to keep to routines or create new ones. Sleep and diet remain critically important to our physical and our mental health. Stay at home, but also try to stay socially connected. Encourage and support your kids to do the same. Phone calls and chats with friends, family, and coworkers is incredibly important to our well-being. Pay attention to what your body and mind is telling you. Don't ignore how you feel. Take time each day to turn off the news and electronics and step outside. The weather is improving, and there is benefit to be found in connecting with nature. Take care of each other. Check in with friends and family via phone. Show patience to our kids. Check in with them regularly and let them vent. Reach out for support if you need it. Seeking professional help is a sign of strength. All of us, including myself, benefit enormously by professional mental health support. We have a wide range of talented and passionate mental health professionals throughout our community who can help you cope. Encourage others to reach out as well. Focus on what is within your control. Distancing guidelines have made some coping skills difficult, but there are several that we can practice and remain important. Examples include deep breathing, meditation, mindfulness, listening to music, taking walks, reading, and of course, therapy. For immediate emotional support, you can call the Foundation 2 crisis line at 319-362-2174 or the Your Life Iowa line at 855-581-8111. Your Life Iowa provides an overview of services available across Iowa for individuals struggling with mental health or substance use disorders. Your Life Iowa website can be found at yourlifeiowa.org. While everyone reacts differently to stressful situations, some signs that you may need to reach out for professional support include thoughts of suicide or self-harming behaviors, difficulty sleeping, prolonged sadness or confusion, substance abuse, or inability to enjoy things that you previously did. Please reach out if you feel you need professional support. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Branch Services at Linn County Public Health. I would like to take a few minutes to remind our local businesses of the guidance for business closure and how to prevent the spread of COVID-19 within the workplace. There are many businesses that are not closed under the governor's proclamation. And if residents have questions about specific businesses, they should call 211 for guidance. At this time, the following facilities are required to be closed: restaurants and bars, with the exception of carryout, drive-through, or delivery; fitness centers, and this includes health clubs, health spas, gyms, aquatic centers. Private fitness centers at private businesses are strongly encouraged to close. All theaters or other venues where live performances or motion pictures are shown. All casinos and other facilities conducting pari-mutuel wagering and gaming operations. Mass gatherings. This includes social, community, spiritual, religious, recreational, leisure, sport gatherings, and any event of more than 10 people are prohibited at all locations and all venues, including but not limited to parades, festivals, conventions, and fundraisers. Planned large gatherings and events must be canceled or postponed. Senior citizen centers and adult daycare facilities, medical spas, barbershops, hair salons, all pools, tattoo establishments, tanning facilities, and massage therapy establishments. Non-essential or elective surgeries and procedures that utilize personal protective equipment. This also includes chiropractic services. All dentists and their staff shall refrain from performing elective dental procedures. This order does not prohibit the provision of emergency dental services. Retail establishments, including bookstores, clothing stores, shoe stores, jewelry stores, luggage stores, cosmetic, beauty, or perfume stores, florist, and furniture and home furnishing stores. Not all business types have been ordered to close, and many business types are not able to fully implement social distancing guidelines. Employees should do their best to keep a 6-foot distance from others. All employees should cover coughs and sneezes, wash their hands frequently, clean frequently touched surfaces, and stay home when sick, no matter how mild the illness. Businesses that are not included in the closure are strongly urged to consider workplace options, such as flexible shifts with fewer people working at a time, telecommuting, and working from home. As I just mentioned, the governor's proclamation prohibits all gatherings of 10 or more individuals, whether inside or outside. Under Iowa Code Chapters 29C and 135, the governor's orders are enforceable by peace officers. We know that this is a difficult time for everyone, including parents of antsy children. In order to protect the community, we are appealing to parents and caregivers to keep their children in their homes or backyard and to try to maintain social distancing. For more information on talking to kids about COVID-19, visit the Iowa Department of Public Health or Centers of Disease Control and Prevention websites. We know that there are many questions regarding the outbreak at Heritage Specialty Care. There are over 35 cases linked to this outbreak that include the residents and staff. Additional information regarding specific numbers amongst residents and staff and additional questions regarding hospitalization and deaths are confidential, and we are not able to release that information. Per the Iowa Attorney General, this information is confidential. We know that this time of year is a time when older adults are returning to Iowa after wintering down south. These individuals should follow the same guidance as recommended for anyone that has traveled outside of Iowa. The recommendations are to self-isolate at home for 14 days upon return to the state of Iowa. During these 14 days, monitor yourself for signs of fever or respiratory symptoms. If you develop any signs of illness, no matter how mild, please contact your primary healthcare provider. Finally, we continue to hear statements from people stating that they are young and healthy and COVID-19 won't have a large impact on their health. We want to remind you, as we have stated several times, even if you are young or otherwise healthy, you are at risk, and your activities can increase the risk for others. As a nation, we have seen otherwise young and healthy individuals that have been hospitalized or unfortunately have died due to this illness. It is critical that you do your part to slow the spread of the coronavirus. Stay home, especially if you are ill, no matter how mild the illness. Thank you.
Good afternoon. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health in St. Luke's, Cedar Rapids here. I'd like to add on to Mr. Martell's comments from Foundation 2. Mental health is vital, especially during this stressful time. Abbey Mental Health Center does have telehealth and virtual appointments available through contacting them, and they are maintaining a service line that's critical to the continuum of health care. Telemedicine in general is evolving so quickly in this situation. It probably is a milestone in healthcare, and it's going to be interesting how that continues after this. But the UnityPoint clinics have a virtual waiting room now. It's some sort of texting platform that you can communicate with the clinic from the parking lot, so you don't have to sit in the waiting room, and then it can give you instructions to arrive. I want to follow up on Heather's comments about social distancing. It is important that we continue to maintain that discipline of social distancing, and I have evidence that it's working, and I'm going to tell you why. We've seen the influenza rate drop precipitously off, more than you would expect just because it's April. So that means people are avoiding each other and not spreading influenza. We can measure that. We can test for that. And we've even increased testing a little bit for influenza in the recent weeks because we wanted to rule out whether or not someone had influenza to eliminate possibilities driving towards COVID. So I congratulate the community on that. It's a measurable milestone that the social distance is working, but we must continue. Both hospitals have traversed the preparation phase. We're now in the standby phase for the patient surge. I feel very confident in my colleagues at both hospitals, as well as the University of Iowa Mercy in Iowa City, to handle any patient surge that we should see. I think the capacity is going to be more than enough that we need from critical care beds. But continue the social distancing. It's working, and it'll help flatten that curve, which will eliminate any concerns if that surge should be more than we expected. Thank you.
Good afternoon. I'm Jeff Pomeranz, Cedar Rapids City Manager. Want to just thank again so many individuals that are working so hard to keep our community safe, in particular our medical community. We have had just a tremendously collaborative relationship with the medical community, and to see the level of dedication, hard work, commitment, competence is very, very gratifying. I know we all have had great confidence in our medical system in Cedar Rapids and in Linn County in our state, but watching in action and having this level of communication has greatly assisted our community. So I deeply appreciate that as city manager. There's so many people that have worked so hard to keep our community safe. Obviously, our citizens who we know are making great progress as far as social distancing and staying safe and following all the rules and all the guidelines that have been put before us. But again, seeing our public safety personnel, our police officers, our firefighters, our EMTs, the great staff at Linn County Public Health is gratifying as well. And there's so many others behind the scenes that don't often get mentioned. So I do want to mention one, and that is our social workers. Often when you list all those that we appreciate, we don't list the social workers. And this was in March, Social Work Month. And so in particular, the medical social workers who work behind the scenes, advocate for their patients, serve their patients, that level, again, of commitment is deeply appreciated. And my spouse is also a medical social worker, so I'm well aware of the hard work that goes on every single day at all of our hospitals. I do want to announce that today we do have a new web page. Often we go to various web pages looking for information, but we do have a new web page that the City of Cedar Rapids has collaborated with the Gazette. And we all recognize that the media and government have our respective roles. But during this crisis, whether it's been the printed media or television or radio, we have really all benefited, again, from the commitment of our local media. This particular project was one of the city and the Gazette. This is a new database that contains just lots of information about business resources. The resource page includes a listing of federal, state, and local resources, so business owners will be able to review the latest programs and resources available, including financial and grant assistance, case management, virtual workshops, and more. The page is featured as part of the Gazette's dedicated coronavirus page, and the address is thegazette.com/coronavirus. Anyway, we hope that the business community finds this useful. This and all Gazette COVID-19 content is free to everyone, of course. The goal of the web page is for the information and resources to be in one place, in an easily searchable format to support, again, our business community. I'd also like to announce that a similar page is in the works for our residents. And the resident resource page is scheduled to come online early next week. As far as city services, we are, again, very appreciative, whether it's our city, the city of Cedar Rapids, or all the cities that join us, as well as the county. Our employees, our public employees, are working hard to serve the community. We all have figured out ways of serving the community without the necessary routine of coming to a physical place, which in most cases are not available. But you know, the city and the county and the other cities around us, again, continue to serve our community and to get the job done. Our police officers, our firefighters, and all the workers throughout the community, again, are deeply appreciated and deeply committed. The water still flows. The wastewater system continues to operate effectively. The fires are put out when that occurs. The police are, of course, still enforcing the law. The streets are being addressed where necessary. A number of contracts still continue as far as our capital improvements for our community, recognizing the importance of social distancing as that work is done. So I just wanted to recognize that government is still operating, and it's not the same, it's different. Dr. Arnold mentioned telemedicine. It may never be exactly the same in the future, but critical services continue to be delivered by our city employees, our county employees, and the other communities, and that's very much appreciated. We obviously have closed and discontinued for a period of time a number of services. Just today, we've taken the additional step of closing Riverside Skate Park, our outdoor basketball courts, tennis courts, and baseball fields. Playgrounds and outdoor exercise equipment were closed previously and remain closed. Signage has been posted at closed facilities, and playgrounds have been taped off. This is difficult for this time of year. We know our kids are not at school, and sporting activities, outdoor recreation is certainly vital for the entire community, but in particular, our youth. So that's very unfortunate from our perspective, but again, we're making these steps, taking these measures in order to have a safe community and to limit the exposure. And there's really no other way of doing that other than closing off these key facilities. So I know it's tough on the families, kids home, not a lot to do, but there's other opportunities, and our hope is that these actions remain in the best interest of the health and safety of our kids and of our community. Unfortunately, related to this, but also other activities, we have been seeing many residents congregating in locations such as I've mentioned, in our parks, in our tennis courts, our athletic fields, etc. So we're taking a number of steps to hopefully mitigate these issues. We've closed the facilities, but we are, throughout the community, wanting to make sure that we don't have significant numbers of individuals that are gathering that are not observing the distancing criteria that we've all talked about so many times. So we've made progress. We know our community is listening. As Dr. Arnold mentioned, there's a lot of progress, but we're not done yet. We're still seeing these groups throughout the community that really, when you look at how close individuals are, doesn't meet the social distancing criteria. And it's not just kids, it's adults. We got a report not long ago where a contractor that was serving the city, the employees were quite close together, and someone took a picture of that. And we really appreciate that kind of input from the community because it comes from a good place. We all need to monitor, and if we see activities that we think are not in the best interest of the community, from a city perspective, we want to hear about those and we want to make the adjustments. So the first thing we did, for instance, when we received this picture of a group of individuals doing some work at the city, we contacted that contractor and they made immediate adjustments. Everyone wants to be safe, everyone wants to do the right thing, but sometimes it's a habit or it's a way we work, and so those need to be brought to our attention. So thank you, public, for sending in that picture, and we've made that correction. Today I'm privileged to be able to call up Chief Wayne German. Chief German is the police chief from the city of Cedar Rapids, and the chief is just going to be discussing from his perspective how the community is doing as far as social distancing, what areas we need to watch, and where we need to improve. Thank you very much.
Thank you. Good afternoon. As Jeff mentioned, my name is Wayne German. I'm the chief of police here for the city of Cedar Rapids. And also, as Jeff mentioned, All the playgrounds, ball fields, basketball, and tennis courts have been closed within the city of Cedar Rapids. I've asked officers to continue to patrol these areas and make sure that the people are complying with these closures. Remember, we're all in this together, and we're going to get out of this together by participating as a group of not putting each other at risk. We all need to do our part by staying at home and only taking those necessary trips of obtaining groceries and medicine. By following the guidelines set by the public health, we reduce the risk of community spread. The police department, we've designed and implemented a continuity of operations plan to ensure that we have adequate staffing to provide law enforcement services to our community. Our officers continue to have personal protective equipment and are continuing to respond to calls for service. Investigations also are continuing. And we've increased police patrols around businesses that have been closed during this pandemic. We've also implemented an online reporting tool that allows our residents to go through our city website to report crimes that are not in progress. This also helps our officers remain in the community and to continue appropriate social distancing. By doing this, it minimizes the interactions that our officers will have by having these types of services provided over the telephone or electronically. When police officers are needed to respond to an incident, our dispatchers have been asking a series of questions, screening questions, that help determine if somebody at that location may be positive for COVID-19 or have symptoms of COVID-19 so that our officers can take the appropriate precautions. Where practical, officers may ask you to step outside so they can speak with you outside your home. And these officers will practice social distancing for the health and safety of everyone involved. Obviously, there's going to be some incidents in which officers have no choice but to come into close contact with victims or suspects. And our officers do have the duty and responsibility to preserve law and order no matter what the circumstances are. And I'm very proud of the dedication of our officers and their commitment to this community. Officers have conducted more than 700 business checks in less than this past week. They've been checking the businesses that have been closed by the governor's public health emergency proclamation, and these officers have found the overwhelming majority, almost 100% compliant. We've only had a small number of businesses that officers were able to use education rather than enforcement to obtain voluntary compliance. During routine patrols, officers have observed a number of vehicles that may be in the parking lot, and upon further inspection, they found that the vehicles are either vehicles of the employees who remain inside an establishment preparing food for pickup or cleaning the establishment. If citizens have any concerns that a business may not be in compliance, we ask that they contact the police department either through our online reporting portal or call the non-emergency dispatch number of 286-5491. And then finally, the unfortunate part is during any emergency, there are going to be people that try to take advantage by attempting to scam individuals in our community, those people who are frightened just like all of us are. Please remember that if you receive an unsolicited call that asks for personal or financial information, please do not provide this information. The United States government is not calling people to get bank information for the federal aid package payments. Please, I ask you to be vigilant about these possible scams through the telephone, mail, or in person. You can report fraud or scams to the Federal Trade Commission at www.ftc.gov. The Linn County Health Department, in partnership with the Sheriff's Office, has issued a media release that a resident of Linn County just recently encountered an individual who came to their residence claiming to be a public health employee. And the Linn County Health Department assured this resident that it was not a member of their agency, and Linn County law enforcement has followed up with this incident and asks all residents, if they encounter a similar situation, please notify your local police or sheriff's department. So I ask you, by following the public health guidelines, we will reduce community spread. And I can't emphasize or be stronger with this message. Please stay home. Please. Thank you.
That is the end of our prepared remarks. We will take questions for our speakers. We are trying something new today, and we have a phone-in system. So we're going to take questions from the room first, and then we will move to the phone. Are there any questions?
I have a question for Heather. Earlier today, the Iowa Department of Public Health released its guidelines and the metrics that the governor's been referring to on the point system of how the state might come to a shelter-in-place order. This has already drawn some criticism from folks across the state, including some in Johnson County, who are saying by the time that the points add up to qualify for a shelter-in-place, it's going to be too late, too dire a situation. With that in mind, here in Linn County, do you think this is a proactive and accurate way to stay ahead of the spread and prevent the spread?
So the question for those that couldn't hear it are about the metrics that are being used to determine if there should be a shelter-in-place rule. We are working closely with the Iowa Department of Public Health. We are following CDC guidelines, and it's one of those things that we're all working together to look at the metrics, to look at different areas of concern so that we can make the best decisions for all of Iowa. It's something that our government leaders are looking at, our local leaders are looking at, but it's something that will constantly be assessed, and we'll make the best decisions that we can together, but we need to follow the guidelines that are put forth to us to follow. So.
And then going off that, one of those four metrics is the percent of hospitalization. I'm not sure if this is referring to what you said earlier or not, but with that in mind, at this point with the 104 cases in Linn County, are you able to tell us how many of those have been hospitalized?
I don't have those numbers with me. We are tracking the number of hospitalizations. I believe overall we probably have had over 20 hospitalizations, but again, I don't have that number with me right now to give that to you. One number that I think we haven't talked about that's a piece of good news, and I think that should be shared, is the number of people that we have that have recovered from COVID-19. And so I did take a peek at that before I left today. We've had over 20 individuals that have recovered in Linn County from COVID-19. So it's one of those things that if we can all do our part, we can work together, we follow those recommendations, we talk to our healthcare providers, we take care of ourselves at home. We talk so much about those that are hospitalized, we forget that there are others that have been at home, that have been recovering at home, and have made it through this illness. So, you know, a piece of good news, a piece of light that we have had individuals within Linn County that have recovered. Thank you.
Are there questions for any other speakers at this time within the room? Okay, we have one.
I have a question for Dr. Arnold. I was just, okay, my first question would be, you talked about how we can measure success of social distancing as far as looking at influenza numbers. Have you guys tried to look at positive effects of social distancing with coronavirus numbers? And if so, how would you measure that?
It would be the case rate, but we just don't have the data. We don't have the data points. Testing is not as widespread to accomplish that, so it's hard to get a denominator that you can trust. That's really difficult.
When you say that the area hospitals are done with the planning phase,
Preparation.
prepare for a surge, can you say if that includes plans for any off-site emergency bed or emergency testing facilities?
Yes and yes. We have contingencies for off-campus placement of patients that may be COVID, non-COVID patients. We have contingencies for that, and we also have contingencies for testing.
You may have said it at a previous press conference, but are you willing to say what maybe one or two of those locations could possibly be?
I'm not comfortable discussing that. Not that it's a secret, only that it might change. But we do have off-campus, the transitional care unit on Council Street, the surgery center. Mercy has their off-campus. So we have an array of those, but I wouldn't want to commit to one of them because it certainly could change at any time.
I'll ask this as a confirmation question to Heather. Heather, I was just adding it up on my computer over, I think, since March 29th, and that there are now 4 confirmed deaths from COVID-19 in Linn County. Can you confirm that?
That is correct. Unfortunately, we do have 4 deaths in Linn County related to COVID-19.
Thank you. And then, Dr. Arnold, does that at all speak to the hospitals being inundated and not being able to?
No, that doesn't speak to that. Both hospitals have, and I think numbers aren't as important as percentages. And we have both hospitals in the corridor, all the hospitals in the corridor have the capacity to almost double what we normally do. And some of the models have said that we need a 25% increase, so we're prepared to do a 100% increase. So I'm very confident that if critical care beds are needed, it'll be there.
Thank you.
Dr. Arnold, while you're up there, other states, including New York, have been actively recruiting tenured doctors, nurses, healthcare workers. Is this something that the hospitals locally are doing? Are you considering doing this at all?
As I stated, that we made our preparations, and that has included a contingency of not only retired physicians, but also perhaps physicians and other clinicians that work in the clinics that maybe not be busy right now, some of our surgical colleagues. And so we do have a reserve corps of physicians with their skill sets cataloged, and we can flip that into place anytime we need it. I would say that's kind of third line. I think we have enough staff right now to do that, but we do have retired physicians that have contacted me, and they're in that database, and we can pull the trigger at any time if we should need to do that.
I think we have time for 1 or 2 more questions. Yep.
I just want a question for Chief German. I was wondering about what enforcement looks like for what the penalties are if there's, if there are businesses that are staying open. If you have, you find a family, for example, that's playing on playground equipment, what that enforcement looks like under city code, under Iowa law and Cedar Rapids code.
Can you repeat the question?
Repeat the question. What is enforcement going to be if someone's violating either the closure of the parks or the governor's order? Lucas, we are handling each incident on a case-by-case basis and asking for compliance after educating and informing the person that they are in violation and they need to cease their behavior. It is a misdemeanor offense, and which can be charged, but again, that is our last resort of taking enforcement action. We want to educate and ask for voluntary compliance.
So this is oftentimes the officer's discretion as they encounter these instances?
Absolutely. Our officers have discretion 100% of the time. And again, since this crisis has begun, every person we've encountered that has not been in compliance has voluntarily complied and acted appropriately to the officer's request.
Thank you.
Okay, I think that'll be the end of our questions from the room. We do have one question on the telephone. Can the caller go ahead? Do we have the caller on the line? Who is it that has the question? Kate Payne, I understand the question is from you. Can you go ahead with your question, please? It looks like we might be having a bit of a difficulty, so we might have to get that question from Kate offline and get back to her. All right, I believe that ends our press conference for today. Thank you so much. Our next press conference is scheduled for Monday, April 6th at 3:30. Thank you.